So I will talk about using consumption and compliance monitoring data to estimate potential program impact. So let's start by looking at the impact pathway of a large-scale food fortification program. The aim of a food fortification program is to increase the micronutrient intake of the population by adding a bioavailable fortificant to the food vehicle, with the aim to increase the micronutrient intake and to reduce the micronutrient gap, and thereby the risk of developing micronutrient deficiencies, particularly of population groups with highest need or greatest risk of developing such micronutrient deficiencies. So a good food vehicle is a food that on the one hand is centrally processed, thereby minimizing the fortification costs, and on the other hand widely consumed by the population and particularly those most in need. Fortification standards should be set based on the amount of food vehicle consumed on average by the population, and should be set at the level that provides a meaningful contribution to the micronutrient intake of the population most in need, without providing excess amounts of micronutrients to those without additional need. And to ensure that adequately fortified food vehicle is available to the consumer, the quality compliance of the food vehicle with the standard set needs to be monitored on a regular basis. This is done at different levels, at the import site, at the production site, or at the market. And we determine if the micronutrient level added to the food vehicle is at the level of the standard. Consumption of the food vehicle by different population group needs to be monitored to ensure that the population groups most in need are reached with the food vehicle and that it is fortified according to standards, and that the consumed amounts can make a meaningful contribution to the micronutrient requirements. And consumption of the food vehicle should be measured periodically, so for example every 3 to 5 years, through household surveys. To assess the potential for impact, we need to know who consumes the food vehicle, how much is consumed, and how much of the micronutrient it actually contains. With the annual consumption of the food vehicle and its average micronutrient content, the annual consumption of the food vehicle, the additional micronutrient intake through the food vehicle can be estimated. With results of specific surveys assessing the micronutrient gap, the potential impact of additional micronutrient intake on the nutritional status can be estimated or directly measured by surveys assessing the micronutrient status. But I'll not go into that here. So why is this information of interest? Compliance data tells us if the available food is fortified at the right levels. It informs program decision makers if, what kind, and where issues in the fortification process and or the supply chain occur, and where enforcement measures and corrective actions must be taken to ensure that the food vehicle available to the population is consistently fortified. Consumption monitoring tells us if they're consuming the food vehicle, so if the population is or different population groups are consuming the food vehicle, and it informs the program decision makers if the food vehicle reaches those in need and allows decision on continuing, stopping, or expanding fortification to other food vehicles. Linking consumption and compliance of the food vehicle allows to determine the coverage of the fortified food vehicle, so basically determining the program coverage, and shows the potential contribution to the micronutrient requirements for different population groups. This information allows to review if fortification levels are or still are appropriate, and if they need to be adjusted. The additional micronutrient contribution from the consumption of fortified food needs to be interpreted together with data from the total dietary intake to understand if it is a meaningful contribution or not, and if it can have an impact on the nutritional status or not. In other words, if it fills the gap in the diet that it was designed to fill. So, compliance monitoring is usually the responsibilities of regulatory authorities. Their inspectors monitor at different levels, which I already mentioned. They go to the production site and conduct inspections of the food vehicle produced in country. This is called external monitoring. Import inspections, import monitoring, and they go to the market or the retail level to conduct inspections called commercial monitoring. And compliance monitoring provides data on the average amount of micronutrients added to the food vehicle, and the average can be determined by brand or by a specific food vehicle type. For example, an average for the available palm oil in the market or sunflower oil, or can be determined for oil available from a specific producer. And the category for which the average micronutrient content is determined should be sufficiently specific to be able to track the respective food vehicle back to the producer or the source, for example an importer as well, in order to be able to take corrective action if we find that micronutrient levels are not according to standard. Consumption monitoring of the food vehicle is assessed for the households or for specific population groups. Consumption data should ideally be provided by food vehicle or food vehicle that is expected to be fortified. And the more information on the food vehicle source, so what kind of food vehicle type, as mentioned, for example, palm oil, sunflower oil, or what kind of oil brand or producer is usually chosen by the consumer. All this information, additional information on the food vehicle source, will enable to more directly link the consumption data to the corresponding quality or micronutrient level. I will try to illustrate this better on an example from Mozambique, where a market assessment was conducted in 2015 to assess the fortification levels of wheat flour and edible oil. And the same amount of samples were collected of each available local oil brand in the main markets of 8 provinces from a total of 11 provinces in Mozambique. The same amount of all the samples collected from one brand in one province were then mixed in equal parts to form a composite sample. And the composite sample was then analyzed to determine the average micronutrient content for a brand in a specific province. Data was also available on consumption of these food vehicles from a micronutrient household survey that was conducted in 2012-13 in urban areas of Mozambique, and the survey provides household consumption data reported as added meal equivalents for wheat flour, cooking oil, maize flour, and sugar. And using the example of oil, I'll show how market compliance data is combined with household consumption data to determine the additional vitamin A intake through oil for specific population groups. So this data was available from the two assessments from the micronutrient surveys. As said, we have the consumption in adult male equivalents by province or by wealth quintile. And from the market assessment, we have average fortification levels of oil by province. So how did we get these average fortification levels by province? We analyzed the average fortification level by brand and province, as I already explained. And now we want to know the average fortification level of oil consumed by a population group. And we are assuming that different brands available and that different brands that are available in a province are consumed in similar volumes by the population in that area. And we therefore can calculate the average fortification level across brands in the province by just taking the average. So here you see the brands, the average levels by brand, and then the 7.6 is the average across the different brand averages. So the volume of different brands available to the population in the market are usually quite different, and therefore the calculation of the average fortification level in a province should be done by applying weights to the fortification levels of each brand that corresponds to the proportion they represent in the market. So basically their market share. This information or the information required to determine the weights can be based on available market or production data volume data. The weight is determined by dividing the estimated market brand market volume by the total market volume. So either in a region or in a province or for the total country. So on the province level, if regional market volumes are not available, we can apply assumptions. For the weight calculation by province, the same proportion as on national level, which you see here, the first column, can be applied for the available brands. So as you can see here, some of the brands are missing, so the values are missing, and we have readjusted the national values to the province to ensure that the total provides 100%. So these So based on the availability data of oil brands in the province, the regional proportions are calculated by brand, and this is done by readjusting the national volumes. So we want to determine the average fortification levels by province. So we first have the average fortification level by brand, and then the average micronutrient level per brand is then multiplied by the proportion the brand represents in the market, or in the oil, or in all oil available in the province. So here are the weights, and they're multiplied, and then the sum of the adjusted averages by brand is then summed up to determine the average vitamin A content of the available oil in the province, which is 6.7 and slightly different from just taking the normal average, which was 7.6. So assuming that the population consumes the oil brands proportionate to the volumes available in the market, we can apply the average vitamin A content and multiply it by the oil intake of the population in that area to calculate the average vitamin A intake of the population. In Mozambique, the average oil intake was determined by adult male equivalents, and we therefore here have the results by adult male equivalent, or the vitamin A intake by adult male equivalent. And to give you a better understanding of what this means, the average vitamin A intake per day can be translated into the percentage of the recommended nutrient intake. So what the additional micronutrient contribution that the food vehicle contributes to the daily requirements of an individual. And the adult male equivalent fraction can be determined for all population groups, and therefore the micronutrient intake and the percent this represents of the recommended nutrient intake can be determined for all different population groups, for example women as well. So we need to interpret this information together with total dietary intake, micronutrient intake, to understand if this additional micronutrient intake is a meaningful contribution to the diet or not. So some areas that still need some ongoing work to improve this work and to strengthen the linkages between the market compliance and the household consumption. So we need to collect further information in household assessments that provide more details on the food vehicle sources, so the food vehicle types or the brands or the producers that are usually selected by the consumer, in order to link the corresponding quality to the consumed food vehicle of the specific population group. Some things that make this link still very complicated is that traceability of the food vehicle available in the market needs to be ensured, and is still often quite poor because labeling is inappropriate. And due to repackaging, the traceability back to the consumer is not always possible. And data on the total dietary intake is often lacking and required to more accurately interpret the micronutrient contribution the fortified food vehicle provides. So these are just some things that we need to work on to make these estimates more accurate. That is all from my side. I thank you.